we know that laser has been used in veterinary therapy. And what do you believe catalyzed the shift in veterinary medicine to embrace laser therapy? Suddenly, 95% veterinary practices use lasers. And if you look back, like there weren't many practices. When I started practicing, there were not many practices that would be using laser.
So I started teaching about laser in 2002 maybe. And it was, I would go to the room and say, how many people have lasers or you have used a laser, know anything about it? And maybe 5% of the people would raise their hand.
Mm-hmm.
Now I go into a room and I say, how many people of you guys have lasers? And at least 95% of the people raise their hand.
Mm-hmm.
There's so much research on it. And I wish that human doctors would use it as much as the veterinarians do, because it has so many effects. Yet, because insurance doesn't cover it for humans, the general practitioners don't usually use it. Your people who are out of pocket. So like I get my teeth cleaned, my dentist uses it before I leave, right? He uses a blue light and it decreases inflammation and kills bacteria. Podiatrists, chiropractors, naturopaths, a lot of those people will use laser because they can and they know the effects. And the veterinarians, I mean, there's tons of research that shows what it's good for, including, post back pain, or post-surgery back pain, or decreasing the need for drugs.
Pain control drugs, painkillers.
Right.
Yes.
Painkillers, NSAIDs, right? So your Rimadyl and your Medicam, all of that can be decreased or gotten rid of when you're using a laser. But you have to use it appropriately and you have to use it as needed.
This wouldn't be the first time where we see the dogs and other pets and animals teaching us about therapies and giving us an example how it could be used in human medicine. So I'm not really surprised. It's a shame that that it's not used in human medicine, but we also know that the education in most veterinary colleges and human medicine colleges is on some level lacking, because there's such a hockey curve of knowledge that has taken place in the last decade or two, that when you look at colleges and universities, it's natural that the senior professors may not be actually that keen learning new things. And I think that the learning is delayed. And with respect to all the people that are teaching and doing an amazing job, but I find it always really fascinating how long it takes for a certain technology or certain method to actually permeate into the materials that are taught in universities. So it's really interesting. I'm sure that people will be probably asking their doctors, why can't I use laser therapies? But could you share some cases where laser therapy effects were beyond your expectations, that just blew your mind because you just saw something that you didn't expect?
Absolutely. Absolutely. I have seen, oh my gosh, there's so many things like wounds, right? I've had a dog come in who had gotten into the river, banged up by the rocks, and literally the elbow was open down to the tendons, and had seen other doctors and they had put stuff on it and we're cleaning it, and they talked about debriding it or taking the dead tissue around it and closing it, but there wasn't enough tissue because it was on the elbow to close it all the way. And the laser did amazing. It healed it, I'd say at least 3 or 4 times faster than everything else they were doing. I mean, the client was shocked. The referring vet was shocked. I was happily surprised that we could do it. The owners actually were coming in every other day so that we could laser it. So it wasn't just like a once a week kind of thing, but that was wonderful.
What is the effect of the laser treatment on the tissue? Like what happens with the cells in the tissue?
So I'm so glad you asked that. I get to nerd out again. Okay. So with specific variables, right? So when you have a lower dose, but you're getting into the tissue, if you remember from vet school, you've got your cell and you've got your mitochondria, and inside the mitochondria where it makes the most ATP, right? Which is like the gasoline, the energy for the cell.
energy source for the cell.
Right. It's the energy source. So at specific doses, it increases cell respiration. So you get way, way, way more ATP. So whatever that cell needs to do, it can do it faster and better, which is great for healing.
Mm-hmm.
And then at high doses, you actually shut it down.
Ah.
And there's like little to no ATP produced. And you'd be like, why would you want that? When you have a lot of pain, you want a higher dose, and it actually shuts down those nerve cells from sending messages up to the brain saying there's pain.
Amazing. So
yeah, so it's actually like a nerve block. So you put enough energy in that it shuts that down. So it's blocking the transmission going up to the brain of pain, so that the dog's like, oh my God, I feel so much better, right? And then the body starts kicking in and it can start to heal.
So it's virtually a two-edged sword, right? Like on one hand, it's going to promote the healing response and gives the cells in the body and tissues the energy to recover. And at the same time, if you go with higher intensity, I guess, it'll shut down the pain response and the nerves that otherwise would transmit the pain and the discomfort.
And it increases the diameter of blood vessels. Right. So you have more blood flow because you need the oxygen and everything that the blood can bring in.
Absolutely.
It decreases inflammation. Right. So if you've got like COX-2, right. So we talk about with our anti-inflammatories, our COX-1, our COX-2 inhibitors, interleukin-1, interleukin-6. There's tons of research that shows that it stops those chemicals from being released from the cells so that you don't get that inflammatory response that in itself can cause more pain. It works on some of like the TRPV1 mechanoreceptors. So things that like cannabis works on, it works on those receptors. It can speed up DNA replication so that you can have cells that you want to divide, like in the gut or in the bladder or cartilage. We can make those divide faster. So the cells that, oh, these are diseased, but we've got new ones coming in so we can feel better.
As you're talking, I'm kind of thinking, have you ever used it for, let's say, lipomas? Have you used it for any other lumps or tumors? Like what would happen if there was, let's say, a lipoma? Can it be addressed? Or what would happen if there was a tumor that you didn't know about? Would it possibly increase the growth, or do we need to be careful about this?
Absolutely. That's one of the contraindications. Now, there is some research that shows with some tumors, again, specific variables, you may have increased blood flow to it, but then you have the macrophages, the T cells that kill the tumor significantly increase around it, but that's very tumor dependent. So in general, you stay away from cancer, you stay away from the eyes, right? Because laser can actually damage the back of the eyes. You stay away from injection sites, right? Because if you put something into the tissue and then your laser may or may not heat the tissue, or it can increase blood flow to the area so that it may change how that medication is distributed in the body, or it may even change the medication. So we don't ever want a laser over an area that was just injected into.